Hello friends and welcome back to Panache Aesthetics, and today we are discussing a case of gynecomastia, and this young individual came all the way from Uttarakhand. He had issue of gynecomastia which was unilateral, much more on the left side. Although he had gynecomastia on both the sides, he came to us with gynecomastia on the left side. When we examined him, we found out that there was a very small gynecomastia on the right side, grade 1, but a large gynecomastia on the left side. And as you can see very clearly in these pictures that the size are completely different. The left side of the chest is much huge compared to the right side. Other than that, the patient, this young man, was a very healthy gentleman. He had no disease. He was a non-smoker, non-alcoholic. He used to work out. As you can see, he had a good physique. Otherwise, had never taken any sort of steroids or any other medication in past. Problem he developed while he was around 14 years of age, and right now he is around 22 years of age. So for last 8 years he had this problem, and one of his friends had this same surgery at our center, and he referred him due to the good results that his friend had, and he came all the way. And let's go through what we did for him and how we planned his surgery. As you can see in this picture, he had a much smaller gland on the right side and a much larger gland on the left side, and we planned his gynecomastia surgery, in which we marked his muscles, and the marking of the muscles was done, and it is very clear on the right side compared to the left side, and the huge gland is visible here. And through a very small cut over here, which is almost invisible in the post-op pictures, we were able to do the liposuction of the entire area. On this side we did not even need a liposuction, and then through a small cut which was given over here as well as here, the glands were removed. And this is the picture as you can see in the post-operative period, and these are the scars as you can see, and they are hardly visible even at 1 month. So as you have seen in the whole planning process, we were well aware that he had gynecomastia on both the sides. Although he came to us with a unilateral gynecomastia issue of the left side. What we had planned for him was liposuction on both the sides and gland excision on both the sides. But once we started doing or operating his left side, we figured out that he had absolutely no fat. Initially what we do is we inject some fluid so as to dissolve the fat and then suck out all the fat. And as you can see in him, we were hardly able to take out 15-20 ml of fat, and there was no fat. He was extremely fit. Everything was a gland. So since there was no fat on the left side, we omitted the liposuction on the right side in him, and on the left side we did liposuction along from the axillary region and then the gland excision as planned. And it was a huge gland, a really big gland, as you will see in the later pictures. And on the right side also we found a gland. It was relatively smaller compared to the left side when we compare, but otherwise also it was a gland. So once the surgery is done, the post-operative protocol is very straightforward. I usually discharge my patient after about 1 to 2 hours of observation if it is done under local anesthesia, and after 6 to 8 hours if it is done under general anesthesia. And he opted for general anesthesia because of his own choice, and he was a bit afraid of blood and pricks and all. So anybody who wants a completely painless procedure, you should opt for general anesthesia. It is slightly more expensive compared to local, but then it is totally pain-free. And it is a daycare procedure, so he was discharged the same day, and he went back to his hotel, and he was called back after 48 hours. On that day we removed his dressing, and these are the pictures in which we have removed his dressings, and this is how they look. Look how even the chest is, even on post-operative day 2, and the skin that people many a times think that would be extremely excess is almost contracted back. The wrinkles that you see are because of the pressure garment, and I advise my patients to wear the pressure garments just after the surgery, and they have to continue wearing the pressure garments for 1 month, no matter what the grade of gynecomastia is. If it is grade 3 or 4, then I advise them to wear it for up to 2 months, and they are advised to remove it while taking bath for 1 hour, but other than that they have to constantly wear it. And then we call our patients back after 15 days to remove the stitches. But for him, since he was from far off, we had put him on dissolvable stitches, which gets dissolved on their own, and he need not come back. He visited us after about a month's time, and these are his pictures that we took at about 1 month post-operatively, and see how smooth the results are. And you can zoom in on the areola and see the scars that we had given. Many a time patients are worried that it will leave a scar and there will be a cut in the axilla, so that small cut in the armpit might be visible, or the cut on the areola that you have given, it will be visible. So these are the pictures of actual patients at 1 month, and how nicely these scars heal. And since it is at the junction of the areola and at the skin, they are hardly visible. And this is how he looks. He is happy at about 1 month. And our protocol is that after 15 days you are allowed to restart your cardio, and after 30 days you are allowed to go back to vigorous activities, gym and everything. He is totally satisfied with the surgery. And so in case you have gynecomastia, in case you have any query regarding gynecomastia, whether it is unilateral or bilateral, you can contact us. We'll keep sharing such case studies. So in case you want to see more such videos, please subscribe to our channel and do like our videos, and do comment on any specific thing on gynecomastia that you want a video on. We'll be happy to help you. Thank you.